Hi, my name's Scott Acord. I'm here in Los Angeles, and I'm speaking with Suzanne Martin.
Yes, my name is Suzanne Martin, and I'm from Tennessee, and I'm here today to share my story, basically.
So we met we were introduced through a mutual person we both know, who also has long COVID, which is how we got connected because you are also dealing with long COVID. Can you just tell me a little bit about your life prior to having long COVID?
Sure. Basically, my life prior to COVID was living on a farm, my husband and I have a couple horses that I routinely go to the horse shows with and compete in the state shows and things like that. And we lived a very active lifestyle, basically, living here on the farm, taking care of everything here. I did go to school for photography, so I do have a background of that, and I do draw and do artwork and things like that as well. And um, also did work as a veterinary technician, helping all the animals and things like that. So,
Can I ask how old you are?
sure, I'm 45.
So you're relatively young.
Yes, and no,
Where in Tennessee? I'm sorry. Where in Tennessee are you?
I'm actually in Charlotte, Tennessee. It's about an hour from Nashville.
So it's a small town.
Yes.
And when did you get COVID?
I actually got COVID back in March of last year. My husband got it first, and I can tell you the just about the exact day, as far as when I think I caught it. Basically, we I'm sorry, we would always take. I know this sounds crazy. We would always take this little dog that we have. He loves to go shopping, and I know that sounds crazy, but that was our fun things that we would do, which we didn't have. You know, we were trying to conserve on money because of COVID, and we didn't really want to go out to many places, and so he insisted that we take him go shopping because we hadn't been in a really long time. So we took him out shopping, and I noticed my husband was kind of sniffling and sneezing in the car, and of course it's getting to be springtime, so he was just it's just allergies, and then the next day he ended up being very sick, and he was running a fever and everything. So I could just about tell you that that's the exact day when I caught it from him. So, and that was at the end of March of last year.
And how many and did you start feeling sick pretty quickly after that?
No, no, believe it or not, I have several flower beds and things like that, and I actually went and got a whole trailer full of mulch to put down in all my flower beds. And so I had actually done that because I knew that was something I could do. Social distancing. They were taking payments over the phone. That way I can still get stuff done, but yet still remain quarantined per se, because they load it with a tractor and everything. But we were both
Yeah.
under home quarantine, obviously, the whole time that we both had COVID. But he ended up getting really, really, really sick. But right prior to that, I ended up showing signs and symptoms. It was about five days later. My symptoms were major headaches. I just felt achy all over. I really didn't run a fever with mine. I had severe nausea, and just like nerve and joint pain. When I say hurt all over, I mean my skin was hurt to the touch. I couldn't even sleep because even my legs just touching each other just was excruciating pain. My husband, on the other hand, ended up getting the respiratory version. He coughed a lot, ran a really high fever, um, and he just really felt really bad all over. I ended up taking him to the emergency room. It was probably about 2 weeks in, because he was just complaining he couldn't catch his breath. He couldn't catch his breath. And so took him to the Dixon Hospital there. And of course, I had to just drop him off because they weren't letting anybody into the building at all. And so a couple hours later, he called me. Hey, they're releasing me. Come and get me. I said, okay. And at the time when I spoke to the nurse over the phone, I told her that he was very, very weak, and that, I mean, he's 6'6". There's no way I can
Oh,
help
wow.
him get around, or I mean, there's only so much that I can do by myself, and my concerns were taking him home. I said, I don't think y'all realize, just how sick he really is. But they did. They sent him home anyway. And so I went and got a pulse ox so I could measure his oxygen and everything, just to make sure that was okay. My husband does have prior pre-existing conditions, as far as he did have high blood pressure. He's diabetic, but it was all fairly under control. He did the best he could as far as, taking care of himself. I think he did a pretty good job. And then I want to say it was like maybe a week later, his oxygen just kept deteriorating and deteriorating. He ended up having diarrhea and that aspect of it, which was new. And then he would run a fever, and then he wouldn't run a fever. But this time his fever really spiked. And so I tried to get him in the truck. And I mean, that was a whole ordeal all in itself, just because, I couldn't ask anybody for help to help me get him in the truck, because we're all have COVID. But I decided I would go ahead and take him to St. Thomas Midtown in Nashville. And we pulled up. I called the number that they said to call. Whenever you get here, call this number. So I called that number, and I told them, I said, I need help getting him out of the car. I said, and his oxygen was like, I don't know, it was like 85 or something like that. He was not in good shape when I took him. And I could not get anybody to come out and help me get him out of the car. We sat there for like
Why is
15 or
that?
20 minutes. This was at St. Thomas Midtown. So we sat there, and I said, we can't just do this. I said, this is just not the kind of treatment that you deserve and that you need. I said, we need to get you treated. And I said, if this is the way they're going to treat you, I said, we need to go somewhere else. And I do believe that everything happens for a reason. Sometimes we don't always know what that reason is, but I just kept telling myself, okay, there's got to be a reason why this happened. Try not to be completely negative about the situation. I said, well, maybe this is just not the hospital that you were meant to go to. So we ended up going to Vanderbilt. So they immediately came out and were super helpful. That has to be one of the many hardest situations, is dropping him off and not knowing, what's happening, and if, honestly, if you're going to see him again or whatnot, because they're not letting anybody into the building at this point still. So I dropped him off. He was well enough to actually give me a call and give me updates, because the doctors were overwhelmed with patients that they really didn't have time to call each and every person, and I get that. Um, but he was in different stages of the Vanderbilt Hospital for several weeks, and all I can say it. This whole COVID thing has been the worst roller coaster ride of my life. There were days he'd call me and he would be, happy, laughing. And then there'd be other days he just said, well, my fever spiked again. My blood work doesn't look good. My blood sugar's uncontrollable. It just varied. He went through the various different oxygen machines and things like that. He went through every single one of them. It was like in stages, just very predictable. I asked a lot of questions to the doctors, and they were all as helpful as they can be, being so short-handed and short-staffed. I thought they did a really good job as far as taking the time out, to answer any questions that I had. So I ended up getting off of my quarantine, and I was talking to the doctors and everything, and they did end up letting me actually go to the ICU when he was put in the ICU. Of course, I had to visit from the outside of the room, and we would do like Zoom on the computer, or he would talk to me on his phone, and I would be on my cell phone, and we'd talk back and forth. Of course, they only had certain visiting hours. So I literally drove an hour there and an hour back just to spend like 2 hours with him every single day. But I went religiously every single day. And he just, like I said, there would be good days and bad days, and his blood work sometimes looked good and sometimes it didn't. And I just would ask the nurses a lot of questions, because the more that I know about it, the more I figured I could be helpful in being his advocate as far as medications, what worked for this patient, what didn't, what's the odds and things like that, just so that I can try to prepare myself and prepare, his family and my family too for anything. Because, of course, then there wasn't as much knowledge of COVID as there is now. So there was always those late night phone calls from the nurses and everything, especially when it got towards him possibly needing a ventilator. There were more and more phone calls, just random hours of the night. I would just no sooner than get home, get to sleep an hour or two, and then the nurse would be calling me. And then, of course, when the nurse gives you bad news, it's not like you can just go back to sleep. But you just have to sit there, because I didn't really have anybody else at the time, and everybody's scared of COVID, and nobody wanted to come over and be supportive. And I get that to an extent. But I had to make some really, really tough choices, and that's one of the things that was very hard to do. Going in there every single day and just putting on this happy face when deep down inside I was just completely losing my mind. Because I knew towards the end, I could see the path it was not going well. I mean, he did everything basically to the book as far as deteriorating. As far as the story that the nurses and everything told me, they said, "When this is what happens when we see people that pass. This is what usually happens." And that's why I appreciate you sharing that. That way I can, prepare myself and be as supportive as I can for him. But it's kind of funny. I bought some dry erase markers, and on the ICU doors, they are all glass. And it's a special room that is oxygen, reverse oxygen, or some, I don't know what that they call it, some special doors where they can go in and out of the room without getting, the virus coming out. But anyway, I went and bought some dry erase markers, and I just every day would draw different pictures on his little windows. I made sure I wrote my phone number as big as possible up there so that there would be no question if anything happened that my phone number, it's right there. There's no reason for them not to call me. But I would draw pictures of the horses and our dog, and he's funny. He caught me, and I didn't draw a picture of his cat, and he confronted me about it. He's like, "Where's my cat?" And he was still joking. I was like, "Oh, I'm so sorry. I'll have to, so draw a picture of a cat and everything." And then I go home and I decide to also make like a little photo album for him just to flip through. It's because they said that I can bring things, but once it goes in the room, it doesn't leave. And I said, that's fine. I said, I want all of us to be in there with him. And so all of his family, all of my family, the cat, the dog, literally everybody. So I made him an album of everything. So all the animals and everything were right there with him in the room the whole time. I even, at one point, was even able to bring our little dog, Samson, which I know that they made a huge exception. But he actually is an emotional support dog, and I'll get into that a little bit later. But so they were kind enough to allow me to bring him. So that, honestly, that's the last time that I had ever seen him smile, was when I held Samson up to the little window and he smiled, and he just, he loved his animals. So the doctors kept telling me, this is just not looking good, and he was asking for anxiety medication, which they said when they get to that point that it's usually a matter of days before they get put on a ventilator. He said, for whatever reason, this is the way it does. I said, okay. And so I'll never forget the phone call in the middle of the night when they said that they were going to put him on a ventilator. And I just had to come up with words of encouragement, or what am I going to say to him? It was just like, because that may be the last time I get to talk to him. I don't know. So that's literally the last time I ever got to speak to him. He ended up going on a ventilator. He just kept deteriorating. His kidney shut down. Just one organ right after another organ just kept shutting down. And I'm sorry, but
Uh,
it's just it's hard. It's hard to sit there so helpless and watch somebody like that deteriorate. There's not even words to describe it. Um, but I called his family, and I kept telling everybody all along. I said, I said, you need to take this seriously. I said, really, you guys should have already been on your way here. I kept trying to tell them. Everybody, I think, was just in denial. This isn't really happening. And they were like, well, you should have called us sooner. I'm like, I did. You just don't remember that part of it. Just kept calling his son, telling him he needed to come see him. He did get to talk to his son. It was like 2 days before they ended up putting him on a ventilator, so that was good. His son did take it pretty hard. But the day that they called me and in the middle of the night and they put him on the ventilator, I, tried to just be as positive as possible. I told him, I said, you're going to make it through this, and then we're going to take Samson, our little dog. I said, we're going to take him shopping, and we're going to go to the park, and we're going to do all these things, and your cat is awesome, and he's doing great. I said, the horses are great. Everything looks good. The yard looks great. I told him I've been cutting it. I said, it just looked, because he was always really worried about the grass and what it looked like and his work. I said, I've already been talking to your work, and that's what he was worried about. And so I woke up that morning thinking, did I really just, was that just the worst nightmare ever, or did that just really happen? And so my son decided he would come with me to the hospital. And I was okay at first, but then we got halfway there to the hospital, and I just start bawling my eyeballs out. I guess it all just hit me all of a sudden. Um, I ended up actually having a major panic attack. Ended up passing out. Um, and I actually didn't even get to see him that day because I had passed out and they were treating me in the emergency room. That's the very first time I've ever had a panic attack. I've never had a history of any issues like that whatsoever before, any anxiety, anything like that whatsoever. Um, so the next day, I was able to get it together, and I went there to visit him, like I do every day. And I did get to bring Samson again, and my son came to and everything. But it wasn't long that he was on the ventilator before his heart rate and everything, they kept putting him on different machines and stuff like that to try to help him filter his kidneys and things like that, but things were just not going well. And so they kept calling me in the middle of the night again, and they kept telling me, he's going septic, basically, is what they said. All of his organs are completely shutting down. He's on every pressor that we have at this point to even keep his heart beating at this point. Um, and so I went there, and then they said, well, I don't think it's going to be too much longer. We've all discussed it, and we've decided that we were going to let you go into the room with him, but once you go in there, you can't come back out, and you immediately have to go back home and quarantine. And I said, I completely understand. I said, I'm familiar with sterile technique. I'm a veterinary technician and I help in surgeries and things like that. So I do understand how important all of that stuff is. And I kept begging for them to let me go in there with them. And so I would. It was touch and go. And then at one point they were like, oh, he seems to be improving. So this is great. But that didn't last very long. He ended up getting sick again, or sicker again, and things were just not looking good. They sent a prayer person to come in, and it was at that point that I realized, that this really is happening, and it's just not going to end well. And unfortunately, this is not the first time I've had to sit with somebody that was very, very ill like that. It was a couple years ago that I had to sit through my dad going through the deterioration part end of it. He started out okay, not that sick, and it was just watching him deteriorate. But I'd made the choice to sit there with him the whole time and hold his hand the whole time because I knew that that's what he would have wanted. And I did the same thing with my husband. I literally sat there for as long as they would let me, hours, skipping lunches, not anything to drink or anything, because you can't drink or eat anything while you're in there because it's all sterile. You have all this garb on you. And um, and so unfortunately, the doctor just, when I did talk to him, he said there is nothing else that we can do for him whatsoever. It's just, we're just waiting on the clock. And he was starting to build up fluid and things like that, because that's what happens when your body starts shutting down. And I just didn't want to see him suffer like that. And it was one of the most difficult decisions I had to make. His family did end up finally getting there. But of course, I told them, I said, you guys waited too late. I said, he has no idea you're here. I said, you could have come earlier when, when you would have been able to talk to him. But the doctors and nurses finally did convince me that that was the right thing to do, was to let him go. And I said, well, the thing that's most important to me, I said, I don't want him to suffer. I said, I don't want him to feel anything. I want it to be as, I don't know what the word I'm looking for is, but as humane as it possibly can. Because I mean, there was no coming out of this. I mean, there just wasn't. I've seen my dad go through the same thing. And I know that sounds horrible. I feel like sometimes I, second guess myself, thinking, well, that wasn't the right decision, but it was, because those drugs were keeping him alive. His body was not keeping him alive. And those, and those drugs are artificial, basically. Artificial substance keeping him alive. And that's just, and to see him suffering like that. So I did start turning off different things, like they were giving him, different antibiotics and things like that. I slowly just pulled that away. I said, well, can we up his pain medication, just to make sure he's going to be comfortable through all of this? And they said, absolutely. And then the prayer lady came in there as well with me, and I sat there all day with him until, and the nurse came in there as well. I said, well, how do I go about doing this without it being like I completely just shut everything off and that is what it is? I said, because I can't do that. And so they ended up just, anything that wasn't keeping him comfortable, we would turn it off. And I held his hand the whole time. I sat there right beside of his bed. I kept talking to him and everything. And I know this sounds really weird, but I felt him squeeze my hand. And I sat there and I told him, I said, it's okay. I said, I'll be okay. I said, if you're tired of fighting, it's okay to let it go. I said, I'll be okay. Samson will be okay. We have family. We'll be okay. I said, don't worry about us. We'll be fine. I said, I know you're getting really tired of fighting. I said, it's okay. If you need to go. And it wasn't too much longer after that he ended up passing away. And I ended up not handling it well, which is like understandable. Ended up passing out again and ended up in the emergency room again. And they were all calling me, asking me, well, what do you want to do with him at this point? And I said, I can't right now. It's just like, I can't. I guess I should have kind of prepared myself more for it, but I mean, you can't. There's no way you can prepare yourself for something like that. It's like, how do you pick up the pieces of your life after that? So I did decide, if it would even help one person, that I wanted to donate his body, which I know that sounds bad, for an autopsy so that they could get samples and things like that, so that maybe they can find a cure. I mean, that's how they get their answers. And I know more about it than a lot of people do just because I'm in the veterinary field. And I know that that's how we get some of our answers sometimes, to be able to understand things better and things like that. And so I said that's fine. That's what I would want. Um, and I'm sure that's what he would have wanted as well. Um, but funeral arrangements and moving forward with all of those kinds of things were extremely difficult. I unfortunately have to say that I do not have a supportive family at all. I have a very toxic family. Um, and I can say that for sure at this point, that it's not me, it's them. And they were so unsupportive through all of this. I can't even tell you. I do have a few friends, but I'm not a social butterfly. I'm always working and always busy and always doing farm work and things like that. So I really don't have a lot of friends to help me through all of this. And so I just was so exhausted through everything, and, trying to tidy up finances and trying to figure out, you know, that whole after somebody passes, dealing with all of everything. It's a lot. And I went to my primary care doctor, and I told him, I said, I'm just not feeling well, and they kept saying, well, it's just because you've had a major loss and, this and that. And I just kept running these random intermittent low grade fevers. And I said, something is wrong. And then I kept trying to go back to work, because several months later, because I'm the sole provider of finances at this point, I've got to work. And I was having a really hard time working and getting through the day and everything. And I kept having this horrible nausea and vomiting, migraines, all of that. I said, this is just something I just feel like is not right. And I'm glad that I listened to my gut, because I did end up, thank goodness, a coworker actually handed me a phone number of a post-COVID clinic. And I was like, what is that? I don't know anything about that. And I finally got on Google, and Googled it and see what it was all about. And I said, well, it won't hurt to make a phone call. So they went ahead and set up an appointment. I had to wait a couple months to get in to see one of the doctors at Vanderbilt, where they had the long COVID clinic. So I went to go see that doctor, and that was one of the more enlightening things I've done in my life, because I realized that I was sick, that I really was sick, and it wasn't all just depression from my husband's death. She was calling it long COVID, and I was like, what is that? And at that time I had no idea what it was. And it was basically all these menagerie of symptoms that are ongoing, that just don't go away after you get over COVID. And my son had a really hard time accepting that. He said it was all in my head. Even after, I had the doctor try to explain it to him and everything, it was still, I can't speak for him. I don't know. I'm guessing it was because of him losing his dad, which I understand. And then he's losing his mom because his mom is sick and everything. But he pretty much annihilated me, and he wouldn't have anything else to do with me anymore. And really, he was the only non-toxic family that I had left, because the rest of my family, I certainly wasn't going to get any support from them. But my long COVID symptoms would come and go. And I kept going back to the doctor. I was like, well, I was doing good last week. I don't understand what happened. I said, it's something that I did or what? I kept trying to keep a log. I said, what? And she said, no. She said that it just, well, the long COVID comes and goes like that. So my long COVID symptoms were major fatigue. I mean, when I say fatigue, I mean there were some days that I would just sit up in bed and just question, how am I going to make it to the kitchen to make something to eat? Some days I would crawl there. Um, and, and, and then there were other days that were better. Um, but,
How were you managing all of your, because you had a job, you had a second job taking care of all the animals in the home. How were you managing through all of this?
um, the best I can, so to speak. You're right. I have a diabetic dog, a diabetic cat, and horses and everything to tend to, and the farm and the yard and everything. It was just, you prioritize, you do the most important things first, conserving your energy as much as possible. Um, like feeding of the animals obviously was pretty important. Mowing the grass, maybe not so much. So there were things I had to just let go. My neighbor luckily came over and he helped mow the yard a couple of times. But as far as dealing with long COVID, I actually ended up losing a whole bunch of weight because I was so nauseous all the time. And I still am to this day. And just various symptoms, anywhere from the migraines that were, they were horrible migraines. There were migraines every single day that just never really went away, or sometimes they get better and then I'd wake up with it, come right back. The doctors kept doing a whole bunch of different tests and blood work and this and that, trying to figure out, what they can do to help me. And it just seemed like it was just one problem after another problem. I probably have, no joke, 20 different problems on my list of things that are wrong with me. One of the main tests they did first was doing an endoscope. I had gastritis, all kinds of inflammation in my stomach. They also did another test with barium where they test how your stomach empties, and my stomach doesn't empty right. And so I have gastroparesis. And now keep in mind, I never had any pre-existing health conditions, except for maybe some allergies or something like that, or an occasional migraine, but nothing like this. I've had all kinds of testing, CAT scans, MRIs, all of that. Sometimes it would show things and sometimes it wouldn't. My blood work, I was anemic. We still to this day can't figure out what that is from. The migraines are uncontrollable. I've tried almost every prescription, every injectable, all of that known to man. I still get them. I still get them very frequently. I have brain fog. Half the time I can't remember I'll walk into a room on a mission, and then I get there and I'm like, I think, okay, now what did I come in here for? And I have no idea. I'll find stuff laying around that I have no idea how it got there. And I'm a very kind of a neat freak person. I like everything to go in its special little place and everything. And so things laying around is not like me at all. And I always used to remember everything and be able to keep up with everything. And this is sad to say, but one day I was having really bad heart palpitations and my heart just felt like it was racing, and I would just didn't know what was happening. So I went to the emergency room thinking, am I having a heart attack? What is happening? They said it was just anxiety, that it was because my husband passed away, and that's what it was, and gave me anxiety medication, sent me on my way. About a week later, ended up sitting at the kitchen table. Heart rate went up to 220. It's like, oh, this is really bad. I really thought I was dying at that point. Went back to the ER. They did an MRI, and I had viral myocarditis caused from COVID. And so that was causing my heart palpitations. That was causing the racing heartbeat all the time. Like, I would get up from laying down and go in the bathroom, and my heart would just be racing. So they put me on some medication for that. That really seemed to help. So far, it does it every now and then, but it's definitely a whole lot better than it was. At one point, I got so weak that I could barely even walk across the parking lot to get in my car after going home from work. I went to the walk-in clinic down the street, told them that I had long COVID, and I said, I still feel like there's something else wrong with me. And just by chance, since I live on a farm, they decided they would test me for tick diseases. And I ended up testing positive for Rocky Mountain spotted fever. And so I have long COVID and Rocky Mountain spotted fever and all these other things wrong with me because of COVID. But I have so much anxiety, so much depression, just because I want to be out riding my horses. I want to be out being able to function again. And I'm not a functional human being even to this day. I may look okay, but I'm far from okay. Mentally, physically, anything. COVID has completely destroyed everything in my life. Literally every aspect, every plan that me and my husband had to do together, everything that we've worked for all this time, I'm having a hard time hanging on to it, which I know that's what he would have wanted, but I'm having to take care of this farm by myself, and and be sick, and it's a lot. And, I have tried to reach out to my son several times, but I guess he just thinks it's still all, I think he's just in denial. He just thinks it's all in my head. He just doesn't want to deal with me being sick, basically. But I told him, I said, I really need your help here. He's just, none of my family's there for me. They're really not. I have a few good friends, and I'm telling you, this fatigue is no joke. When I say, and unfortunately, something bad had to happen before I actually realized my limits physically. I was working on putting in a fence post with, I don't know if you know what a T-post pounder is, but I was pounding in a T-post. I had to get this one up to fix the fence for the horse. Like, it was the one thing that I had to do on my list that day. Even if I didn't get anything else done, I said, I have to fix that. And so I was out there. I almost had it the way I needed it. And I was really tired before I even went out there. This happened just a couple months ago. My finger slipped off the T-post pounder, and I ended up pounding my finger. It got in between the fence post and the T-post pounder, and I ended up amputating part of my finger off. When I say fatigue, this is what I'm talking about. I have put in hundreds of T-posts. Hundreds. I have never hurt myself. All kinds of fencing, doing this, doing that. I could not even go out there and do that. I've had to have multiple surgeries. I had to go stay with somebody for a couple months because it was so bad. My finger was so bad. And I'm still recovering from that. And that's been several months ago. But it's going to be always that reminder of, hey, Suzanne, you really do have limitations. And I really do feel like it was God's way of making me stop, because that really is the only way I would have stopped, is that if I physically couldn't do it, couldn't do anything anymore. So
sorry you've had to endure quite a bit.
yes, definitely. And that, people just, to look at me, like I said, I look fine. I literally have 20 different things wrong with me. And people just, and doctors, I think sometimes they want me to do all these physical therapies and things like that. And I keep trying to tell them, I said, you've got to remember, every little thing that I do adds to this bucket of once it gets full, I'm done. Like, there's nothing I can do about it. Like, my body gives out, I'm done for the day. And if I push myself at all, injuries happen. So they got to keep in mind that, okay, great, physical therapy, I'm an hour away from anything. So it's an hour drive there, it's an hour drive back, it's however long they keep me for physical therapy, things like that. It's just been, I don't have a ride. I don't have anybody to take me anywhere to do anything. So it's been really difficult. My work has been more than understanding. I haven't worked in months, but I still have a job because they told me I will always have a job there, they said, because I guess they must really want me there. I don't know, but I'm like, any other job, I would have already lost it a long time ago. Because, I literally work a day or two here and there if I can, and I haven't been to work in months. And that alone is just hard mentally to deal with. Not being able to do any of these things. Yes, I lost my husband. Yes, I'm grieving over him. Do I have anxiety over it? Yes. Do I have anxiety and depression from long COVID? Yes. It's all of those things. Absolutely. It's all bundled into this complicated mess. And that's why it's so hard, because I have all of these different problems wrong with me now. Some days I can eat, some days I can't. Some days I can maybe walk to the mailbox and be okay, some days I can't. But it's hard to remain positive or have any kind of life beyond being sick or anything. I've tried doing puzzles. I know that sounds really silly, but I said that's sitting down. I can still do something. So I bought some horse and dog puzzles, of course, horses and dogs. And then I've started drawing again. And so I've drawn some horses for my favorite doctor. And so I gave her that for Christmas. And I still have other pictures that I've given to my friends. The lady that she let me stay in her house for a couple months while my finger healed. I drew her a picture as well. So that's just something that try to keep my mind out of going, quote unquote, going down the rabbit hole is what we like to call it. Just going into a bad, negative space. So, and people say, well, why don't you just go outside and take a walk? Well, you're expending your energy doing that. And I know that sounds really, people that don't have this kind of fatigue don't understand.
Yeah. Well, I'm so sorry you've had to endure so much over the last year plus. I mean, it's a lot. It's a lot for any one person to have to go through. And I'm so sorry you lost your husband. And that you don't have much of a support group around you. With your family and such. It's I'm not entirely sure how you do it.
Well,
Takes a lot of strength and willpower to pull up and get it done every
thank
day.
you. I appreciate that. And honestly, it is getting harder and harder. And I hate to be negative about it, but I'm exhausted. I mean, it is so hard to even get up every single day. And I never know how I'm going to feel physically. How am I going to feel today? I can't really go to work and hold down a normal job and everything because I never know how I'm going to feel. And I'm so tired. Physically and mentally, I'm just completely exhausted. And I, I don't know how I'm doing it. I guess because I'm a really stubborn person and I just don't give up. But I am getting tired at this point. I would think by now things would be getting better, but they don't really seem to be getting better. Things are just changing as far as with the COVID symptoms. I'm getting worsening brain fog. I now, just in the last week or two, have started having hand tremors. They don't know why. Like, I recently can pick up a glass and I mean, I'm just shaking. I, how am I going to go to work or do anything really with all of these random issues? And like I said, I'm so tired. I am. I'm so tired. But thank goodness I do attend a long COVID support group that has been really great. We have a group chat and we will chat back and forth on the group chat. We'll post, like I posted a really funny video of my horse running down to eat his feed because he bucks and he kicks and he runs down and he whinnies and he's just the funniest thing. I've never seen a horse so excited to eat. I mean, I know horses are food hounds, but not like this horse. Or I'll dress up my dog, and I know this sounds silly, in a raincoat, and I'll post that. Just even if I get one smile out of somebody, or we'll communicate to each other. Hey, I'm having a bad day. And we'll send our support that way, if that person needs it. And it's just, I highly recommend support groups for anybody that's having any kind of grieving issue, any kind of mental, physical issue, fighting a debilitating disease of any kind. And coming from me, that's saying a lot because I hate to say it, I'm not a social person. I'm very shy normally. And I'm a great patient advocate for the animals and anybody else but me. So I'm having a hard time with that. I need to be a better advocate for myself when I go to these doctor's appointments. And and things like that. I really need to be more supportive of myself, and I need to be saying, hey, family, you guys are toxic, just to, even if it doesn't change anything between them and I, at least I get it out of my system and get it off my chest. But as far as, um, you know, support groups and things like that, it's hard. I'll be honest, it's hard to get started. But once you make yourself do it a couple times, you will reap the benefits from it. You will, as long as you at least have a partial open mind about it. I think that they have a lot to offer. And I can say this
Well,
in finishing it up, thank goodness for animals. Because if it wasn't for these animals in my life right now, I would not be here today. I wouldn't be. Because it gives me something. You have to take care of them. Who else is going to take care of them? I have to. And I have a special needs dog that I have to actually make his food for him, and it takes hours, to make all his food and everything, and all his medical problems and his pills and this and that. And a normal person is not going to be able to do that. God gave me that dog for a reason. It was because he knew that I could take care of him, and vice versa. That dog has saved my life because I know where would he be without me. So thank goodness for animals.
yeah. Well, Suzanne, I just want to say thank you so much for sharing this very personal story. But I think there are many people probably in your shoes and in some capacity suffering with long COVID and having lost uh, a spouse to or to COVID. So just thank you for sharing. I appreciate it.
Well, thank you so much for taking the time today to, I'm sure you're super busy with a lot of other things, but I appreciate you taking the time today to interview me and everything. And if my story can help even one person, then it was totally worth it.